Well, we're talking about male pattern baldness today, and it's of great concern particularly to younger men. But we have on set with us today Dr. Zulfiqar Tunio, and he is, and thank you very much for joining us, and he is a hair cosmetic, I beg your pardon,
cosmetic, plastic and hair restoration, sir.
Thank you so much for being on the show, Dr. Tunio.
Thank you.
Dr. Tunio, we'd like to ask you the first question being the definition of male pattern baldness.
Male pattern baldness is a condition in which there is a receding of a hairline in a male in a specific way, that there is a M shape. You can see, it's a start with, and the hair in the front, they are certainly different from the sides. They are fine, wrinkly, and it's progressive in nature. So certainly there's a broad forehead, and sometimes it affects, it starts with the crown as well. So being a progressively, it affects the frontal part and the vertex and crown.
Dr. Tunio, tell me, what is the the age of onset for male pattern baldness?
Majority of the people, which suffer from male pattern baldness are in age of 20s. It starts in teens and affects shows the results, shows the effectiveness in 20s, and then
manifests itself in the 20s.
It's making me very curious, and I'm wondering, is a male hair follicle different? Because there's no such thing as woman pattern baldness.
There is.
There is?
Yeah.
Really?
But it presents differently. In female, what happens, there's a presentation is in form of a thinning rather than a complete loss, like
you never go bald.
I have seen though, very rarely.
Rare.
Yeah, very rare.
It's common in men.
Yeah, it is very, very common in men.
Right.
Well, do you have any data on that off the top of your head? What percentage of men go bald? What percentage of men have this condition?
If we look at the 20s, about 2 to 4%.
Okay.
And if we look at the age of 50, then nearly 60% people are the bald.
Really?
Yeah.
It's as much as that?
Yeah, it is.
And
certainly.
it's a sensitive topic for men.
So very sensitive. Very sensitive.
Do you think that I mean, I know baldness affects men. It would make me feel uncomfortable if I was bald. I wouldn't like it. But presumably it must have an emotional and a sort of psychological impact on younger men when it happens.
Well, it varies from person to person.
Oh, okay.
And I have seen very devastating effects, especially on the young individuals,
Sure.
who are students and progressing in a career. They go and isolate themselves, and they are really suffer a lot. They can't present in a proper way.
But why is it that men experience male pattern baldness? Why does this happen to them?
The medical is, once fetus is within the womb of mother, there's a shift of gene from father as well as mother. So in a specific area, when male loses the hair, the receptors, the follicles, they are receptors on the follicles, are roots. These receptors become sensitized with one of the male hormone, androgen, that is called dihydrotestosterone. So at the age of adult, when there's a change in the hormones, so these hormones go and stick with these follicles or roots, bring the miniaturization changes in these follicles, and the growth pattern is altered.
And is it hereditary?
It is hereditary.
It is.
But it is not only simply hereditary, it will be, both of the factors should be there, hereditary as well as hormonal change.
Okay.
This happens, you might have seen a person, 4 of the brothers in a family, 2 are bald, 2 are not. 2 are having a gene, but there's no change in hormones, so they're spared.
We just come to I don't know if we should call it a common myth, but there are some men who will say that it's the water that's making their hair fall, or even women. It's all in the water. My head is, I've got lovely hair, and the water is bad.
Let's have a big massage and all come back.
There are a lot of fallacies regarding the hair fall.
Is this true?
There are a lot of fallacies.
Hard water, soft water.
There's no any scientific foundation for that. There's no scientific foundation for a change because of water, because of shampoos, because of a change of weather, and because of a lot of other things,
Has research been done where they've used hard water, soft water, mineral water to wash hair, and
it doesn't make any
difference? It doesn't make a difference. Dr. Tunio, more and more men seem to be losing hair at a much younger age, and earlier on we had shared a segment with all of you, which was on, for lack of better word, 3 bald men. No offense to any of you, but we showed them, and we're wondering whether it's a change in, there's global warming and there's environmental changes. What is affecting, or are men using hair at a younger age? Are they?
And I want to add to what Shazia is saying, and just give it a slightly different dimension. Is that just because we're living longer, so it manifests itself more?
Certainly the incidence of baldness is increasing even in the younger age group as well. Why is this happening? There's quite ambiguous things, which are going on probably. Scientific reason is the two of the reasons, they go side by side. One is genetics, another is hormone change. There are certainly other reasons as well, just as autoimmune disease.
Yes.
They play a part, and there's a patchy loss. You might have seen quite a common in Pakistan as well.
Alopecia.
Alopecia areata. Some irradiations, somebody getting treatment for the radiations.
Sure.
Somebody getting a treatment for the cholesterol lowering agents. These are blood pressure medicines, These are the reasons for the hair loss as well.
And presumably with all this global migration and so many people marrying from different parts of the globe, would that somehow influence that, and you'd have a greater pool of people going bald? I don't know. This is just
one of the factors, because for close marriages in a families, that could be one of the reason. But even if the gene is not present in father's side and gene is present in mother's side, it presents in the same way.
Now, coming to your profession, how effective do you think hair transplants are?
I think it's I'm playing a very, very good part in the society if I'm doing hair transplants over here, because I'm giving them happinesses. The people come and give a comment like, I didn't see the mirror for last 8 years, believe me.
Dear.
And now I have started to like myself, love myself, starting to clothe in proper way. So that is basically self-esteem, which increases because of.
Aside from the hair transplants, are there other remedies or other cures that people pursue, that patients pursue?
There are other non-surgical methods as well, just as hair pieces and.
I see that way, right? Okay.
There's no other method.
Other camouflages, and implants, filaments, that is synthetic hair.
Does that
These
hurt?
are things,
Does that hurt?
These have been worked, in past, but now nobody is getting filaments nowadays.
Do hair transplants hurt?
Yeah, that's what I was asking. Do they hurt? Are they painful?
Hair transplant, hurt certainly. I mean, it's a procedure and it's a surgical procedure. We just as you go for dentist, dentists stick a needle inside and freeze the area and then work. It's the same way as we try to make the patient very comfortable and use the finest needle on the earth.
So if you've passed the crown and vortex, how many injections do you need?
So I can't tell you. Nobody is going to come to me if I tell you the number of injections.
Many.
Really?
No.
Certainly many. But once we give a nerve block, nobody is going to feel the pain.
And they're awake.
Okay.
Only the 2 needles. That's it.
And they're awake.
Yeah.
And
They're awake, aware of everything. Going for a lunch break, dinner break.
We get a hair transplant and go back to work.
It's a total outpatient
They're watching telly
procedure.
most of the time.
Thank you very, very much for that very wide range of information about this particular condition that so many people suffer from in the world and also in Pakistan. I think one of the wonderful things that you do is you give people hope. And life at the end of the day is all about faith and hope. But I think there's a lesson to be learned in this, and the lesson is be safe, not sorry, ask the right questions, and go to a learned plastic, cosmetic and hair restorative surgeon. That's what you need to do. Thank you very much.
Thank you so much.
Thank you very much.
Thank you very much, Dr. Tunio.
Cheers.
We do need to take a break right now, but before we leave, we'd like to urge all of you, if you are feeling emotionally insecure or your self-esteem is down because you're balding or your husband is balding or your wife is balding, you know who to go to now. Take a break and make your appointments fast. We'll be right back.